It's changed my life in so many good ways. I used to live with a lot of fear and insecurity, and so it kept me from doing things that I might find frightening to me. And after cancer, when opportunities arose that I might have originally turned down out of fear, I took the challenges. It's like, if I can beat this cancer, why can't I climb Mount Rainier? And if I can beat this cancer, why can't I ride my bike from Oregon to Canada in 3 days? And if I can beat this cancer, why can't I take a job as a firefighter, something I really want to do, and leave the security of my research job for something that was really unknown? And it's really enriched my life. If you come in and work hard just like anybody else, then you're just one of the crew. When I was going through treatments, I'd only been there 3 years, which is really new on the job, and they worked every shift. I was off for 6 months going through treatment, and they worked all my shifts, so they'd come in on one of their days off, put in 24 hours for me. And so I didn't take any sick leave, didn't lose any benefits. 50 of the guys shaved their heads. We had a big head shaving party at work, so when my hair fell out, we had a bunch of baldies walking around. You just make the best of it. The first time I had cancer, after my hair fell out, it was around Halloween. I went as an 8-ball for Halloween. One day I found this little hard area, and even then when I found it, I really didn't think it was going to be anything. And then just going through a series of doctor's appointments, and let's do an ultrasound, and we see something, and let's do a biopsy, and it turned out to be cancer. I was pretty shocked. Ended up having surgery for it on my 33rd birthday. It's funny, the guys at work, because I was really open about it, and so they were comfortable making jokes or, asking me whatever they wanted to. And when I was going in for reconstruction, they were asking how they were going to do it. Well, they took tissue from my lower gluteal area and moved it. And so right away all the jokes started. He goes, do you ever have to ask anybody, does this t-shirt make my butt look big? They were like, you brought all this out, you were so open about it, it made it okay for us to talk about it. And I told everybody, you need to go home and tell your wives or your moms, your girlfriends, do their self-exams, because I found both of my cancers on my own. And one of the guys went home and told his wife that. She goes, well, I'm busy, but she did a self-exam and she found a tumor, and she had breast cancer also. Ended up going through treatment at the same time I did. It was really out of the blue. I happened to be in the shower one day doing a self-exam, and it only started getting better about doing those because I was working in cancer research and seeing samples come across. Some of the patients had been kind of young, and I thought, well, maybe I should be better about doing a self-exam. So I had started doing them and had found just this little hard area in the left side. It didn't feel like a lump, didn't feel like a tumor, but I needed an asthma inhaler prescription, so I went into the doctor, which is really, and then while I was there, just said, hey, can you take a look at this? And she was very, very condescending about it and said she could make an appointment with a breast surgeon that could teach me how to do a self-exam. And I was like, well, I found something. I just want to know if this is anything to worry about. Breast self-examination has saved my life twice. I found both of my cancers on my own. The first time, again, being in my 30s, I wasn't even getting, once a year you go to the doctor, and every doctor that examined it did not think it was cancer when they felt it. And if it hadn't been for me saying, this is new and we need to check this out, they would have never caught it. The second one, again, being 41, I was getting regular mammograms, but neither of my cancers showed up on mammogram. So it was really up to me to find it. I found both of them at 1.2 centimeters, so still small enough, big enough to be detected by my hand. And I always say my fingers are calibrated for 1.2 centimeters since they were exactly the same size. A mammogram can find it when it's maybe 10 times smaller than that. But even at 1.2 centimeters, neither of them showed up on mammogram. So wow. Do your self-exams.
Big smile. Really big smile. There you go. This hand, see, this is your top. Just kind of bring it up a little bit. Ways it remain the same. And as my mind beats on the major song, you'll say, just a little bit.
Oh, that's cute.
I love it. You are a gorgeous baby. Yes. Exactly what I wanted. Is just that little bit of movement. Yeah. No, I actually like what you were looking at.
It's pea size, but there are almost, they say when it's that size, 1 billion cancer cells at that point.
And those can be traveling around in your body.
They say by the time you've reached that size, they are. That they've broken off and they're traveling, and that's why you do chemo. Even though it's not, you don't see it in the liver, you don't see it in the lungs, but they're there, and so you do chemo to try to kill those cells that are just kind of sitting out in your body.
Let's turn it over this way, Scott, because it's this way with that ball. See that ball? That is wrapped.
You just have to go through every day of, I need this treatment, I need surgery, I have to do chemo. You get through it and it gets better. Your hair comes back, your body recovers from everything, and you have this whole life to look at. You look at it in a new light, and you really learn to appreciate life. And when you're in the middle of it, it's hard to focus on that, but it does come and it does get a lot better.